Hello, I'm Dr. Sarah Kennea from Whistler Medical Aesthetics, and today we're going to have a discussion on the MD codes and also give you a live injection demonstration demonstrating the use of the MD codes to treat the mid-face. So what was a common approach in aesthetics in the 90s that patients would come in complaining of the nasolabial fold and the doctor would fill the nasolabial fold. Whereas the MD codes looked more at the underlying causes of why the nasolabial fold is becoming more prominent and worked on an approach but more based on lifting the face, myomodulation of the face, and replacing the volume more laterally, which creates a lifting effect and therefore ends up with an improvement of the face by treating the cause of the problem rather than just the symptom. The second concept of MD codes was learning to develop a systematic approach for injecting rather than an intuitive approach. Whereas Dr. DeMaio has developed the exact active numbers and the exact product that creates the best effect in a specific region of the face. So now I'm going to move on to assessing my patient. Today my patient is 41 years old and we had a consultation during which time we assessed that she felt she was looking tired, that she was looking saggy, and she would like to look more youthful. And when we asked her the specific features on the face that she would like to improve, she identified the under eye area that she felt made her look tired, the nasolabial area which she felt made her look saggy, and also the jowl area which also she felt made her look saggy. So now we're going to move on to treating the patient. First of all, we're going to create the markings for CK1. CK1 is going to be 0.1, 0.1, 0.1 in Voluma. And the marking for this is the suture line between the temporal and zygomatic bone. And if you put your thumb into a little depression here, you can find it just sits in the little depression of the suture line. So then the next CK1 is a centimetre anteriorly and a centimetre posteriorly. Then we will mark the tear trough, which will be treated TT1, TT2, TT3, and then CK3. Soothe, and bolus. To mark the borders of CK4, I will get the patient to bite down. That's great, thank you. And find the anterior border of the masseter, and that creates the anterior border of CK4. And so now we're going to move to treating CK1 with Voluma. So we clean. Always make sure we clean before each point. And then we retract the skin, needle to bone, aspirate, and 0.1. Second point, retract, inject, aspirate, and then 0.1. And the posterior point, inject, aspirate, 0.1. If we assess the lift, can I get you lift camera? We can already see some lifting effect on the jowl, a slight eversion of the lip. Nasolabial fold looks slightly improved. Then we're going to move to CK4. CK4 will be with 0.5 mils of Voluma via cannula in the subcutaneous plane. So we clean, needle entry point, pinch, add my Voluma on cannula, and then we inject 0.5 mils in the subcutaneous plane. Next, we're going to move on to CK3 Soothe, which we're going to treat with Volift, 0.5 mils. We'll clean, needle entry point, pinch. So the way to achieve this exact tissue layer is to inject, and then immediately we're into the tissue, we track backwards as if point directing back towards the skin. And then in a fanning motion, we inject 0.5. Next, CK3 bolus. We clean, elevate the tissue, and inject bolus to bone, aspirate, and inject 0.3. Now we're going to move on to treat the tear trough with Voluma, and we're going to treat TT1, TT2 and TT3 with 0.2, 0.2 and 0.1. Going to pinch and then we use the cannula to inject in the supraperiosteal plane, and my finger is feeling the infraorbital rim, and I'm using microaliquots. And finally on this side, we'll proceed to inject the nasolabial fold. This patient does not have a deep nasolabial fold, so I assess that she will only need 0.5 mils, and for that we're going to use Vollift. So now the improvement we can see on the treatment of the right hand side of the face is that we have a slightly opened eye due to myomodulation of the orbicularis oculi by the TT codes and also by CK1. We have improved cheek support to the tear trough. We have an improved tear trough appearance. And we've had some lateral lifting with our CK4 as a lateral lifting vector. So we have less jowl. So we've improved the eye area, the nasolabial and the jowl, which were the three areas that she wished to see improvement. So I hope that this video has explained the principles behind MD codes, an example of the use of MD codes to treat the mid-face, to treat the emotional attributes of less tired, less saggy and more youthful.